Hello everyone, I'm Priyanka Mailavarpu, pursuing my BA in Mass Communication second year from St. Mary's College, Exton. A very warm welcome to this vibrant platform, Pandemic Perspective, which is a week-long e-conclave by the students of alumni to the Department of Social Sciences and Communication. The main objective behind this event is to ensure the transition of academic ideas during these tough times. For this e-conclave, I welcome our head of department, Dr. Joseph Christodos, our faculty members, and the participants. It is a great pleasure that I introduce you to Ms. Rachel Vandana Chedalawada. She is joining us from Juba in South Sudan. She is communications manager with the Samaritan Spurs in South Sudan country office. She is from the class of 2007, the very first batch of BA in this college. She is the one who composed our college song. After her graduation, she worked with a business development manager and then with the Consulate General of the USA as cultural assistant before going to do her master's in strategic communication in USA. She is a blogger, a traveler, dreamer, and an achiever. The topic she would speak on is pandemic and the humanitarian crisis. I heartily welcome you, ma'am. Now I would like to hand it over to you.
Thank you. Firstly, I have to say it's an honor and a privilege to have anything to do with my alumni, and I'm even more privileged that I get to be a part of this conclave and uh, just share about my experiences. St. Mary's College has had a major impact on my life, and I've made the best of memories there. I'm still in touch with, obviously, I'm in touch with my friends, but I think a lot of credit goes to the fact that I'm still in touch with most of my lecturers, and I think that's an amazing thing. Not a lot of colleges can say that, but a Marian can definitely say that. Thank you so much for introducing me. I work as a communications manager with Samaritan Spurs. Samaritan Spurs is an international disaster relief organization. What that basically means is that whenever there's a disaster in the world, if a government accepts help, Samaritan Spurs will be there. Right now, Samaritan Spurs has recently provided frontline services in Italy, which was the epicenter for COVID-19. So Samaritan Spurs went there, set up a mobile hospital, and provided healthcare there. It also provided healthcare in New York, which was the epicenter in the United States. So I work with that organization, but I work in the South Sudan office. It's been a year since I've been, going to be a year since I've been here, and I've enjoyed every bit of it. It's inspiring to be able to not just identify a crisis, but also be a part of the solution. But at the same time, it's very sobering to see that the crisis is humongous, and what you're doing is actually just a drop in the ocean. So I'm going to start off with just giving a little bit of perspective in terms of what a humanitarian crisis is, where does South Sudan come into play, how is the COVID situation here, what are the challenges that we face, and because I live and work in South Sudan, that's the perspective I'm going to be bringing to our entire discussion today. So the first thing I want to talk about is, what is a humanitarian crisis at all? Is there like even a definition that you can associate with it? But if you really think about it, a humanitarian crisis is basically an event or a series of events that represents a critical threat to health, to safety, to security, or to the well-being of any community or a large group of people. And usually it's over a large and a wide area. And most often, humanitarian crises are of three types. One is that the crisis is man-made. Two is that it has a lot of natural disasters, or it is because of a natural disaster. And three, they're basically complex emergencies. And what are these complex emergencies? Complex emergencies are basically a good mix of man-made crises as well as natural disasters. Now, unfortunately, South Sudan is a prime example of a country that has all three of these: man-made disasters, natural disasters, and complex emergencies. South Sudan is the youngest country in the world. It got its independence in 2011. But right after it got its independence, within 2 years, there was war broke out in the country, and government forces started clashing with forces from the opposition, and there was immense bloodshed. People lost their lives. That just sent the country tumbling down into a spiral of crisis. It started in 2013 and it went on till about 2018. And this was because it was still a brand new country at the time. The impact that this kind of war had on people, on the economic structure, on the healthcare systems, and just the way of life has been enormous and incredible. So what started off as a war between the government and the opposition, it turned into a very civil. It turned into a civil war where communities were fighting against each other. And you have to understand, with South Sudan, it has a very they take a lot of pride in tribes, and the country is actually there's a primary tribe. There are several tribes going on. And so what happens is, if the leadership is fighting, then the tribes of the two leadership also start to fight. And that unfortunately becomes a terrible man-made crisis. And that's what happened in South Sudan. There has been extensive violence, intense loss of life, which tumbled into intercommunal violence. And even now, there is, I have to backtrack and say, in 2018, the government and the opposition, they signed a peace agreement, and peace eventually came to South Sudan. In fact, February of this year, the transitional government was formed. And so far, thank goodness, there's not been any war. However, intercommunal violence is still a big thing. People fight over cattle, people fight over possessions and land, and that becomes a big issue again. Because of these violences going around in the country, there have been millions and millions of people who have been displaced within the country, and we call these people internally displaced peoples, IDPs. So South Sudan now has, firstly, the country itself is in shambles because of all of this war. Then you add to that communities fighting amongst each other, that raises intercommunal violence, and the whole country is disrupted. And we have IDPs running away from their homes, trying to find a place to survive. And then war broke out in the north of South Sudan, which is basically Sudan. And people ran from there and came to South Sudan. So now South Sudan has its own host community, it has IDPs, and it has a lot of refugees coming in from Sudan as well. And so the refugee camps in South Sudan, we have camps in Maban, we have camps in Mayandit, and there are several other camps in South Sudan. And primarily they're run by United Nations mission in South Sudan. It's called UNMISS. And these refugee camps are called POC sites, persons of interest sites. Now, the biggest challenge and fear and threat with COVID is that if COVID enters a POC, then there's no way of controlling it, because POCs are very crowded. There are lots of people there. And it's very difficult to ask someone to socially distance themselves when they're living in a small, tight space with, say, 8 to 10 people living in their home. It's very, very difficult. So that is one of the primary challenges that we face in South Sudan with regards to COVID. And I'll get a little more into that. Another thing that makes South Sudan a place for great humanitarian crisis is natural disasters. There usually whenever there's rain, and when it rains here, it pours. It is straight up flooding. And this is because there are 5 rivers that are around South Sudan. One of them coming from Ethiopia, and when that comes through and there's rain, it floods the whole place. It floods the cities, floods the villages. People live in mud houses here. And so as soon as there's a flood, the first thing that's going are the homes. Now, if you don't have shelter, then you're vulnerable for more diseases, because where are you going to hide? Where are you going to take shelter? Where are you going to keep yourself safe? There have been stories of people who have lost their homes in flooding, and had to live under a tree for 3 months before they could build their home up again. And so it's a very dire situation here. It's a very dire state of how people are living. And then you add to all of this the fact that because war broke out at a time when the country was brand new and very, very young, it didn't have an opportunity to really build up its economic system. And so the economic system, the structure is not very great. The healthcare system is not very great. Even the best healthcare system that you find in South Sudan is very, very, very minimal. So it really doesn't help a lot of times. Because of extreme poverty, unfortunately, there's always a rise in criminal activities, like, there's theft going on, and that's why cattle raiding happens, because people don't have enough for themselves. They don't have food, they don't have clothing, they don't have shade, they don't have finances, none of it. So that poverty is not just limited to a lower sector of people, but even in the middle class homes, poverty is a big deal. And so corruption goes up, and it just becomes like this crazy cycle of not being able to get out of it at all. South Sudan is the world's 4th largest humanitarian crisis. The country is small. It has about 11 million people. That means it's just a little bit bigger than Hyderabad. That's it. Hyderabad has about 10 million people. South Sudan has about 11 million people. However, from these 11 million people, about 6.5 million people are severely food insecure. What does that mean? That means 6.5 million people have are experiencing malnutrition because they don't have food to eat. That is more than 50% of the country. About 7.5 million people require humanitarian assistance. Now, this could be food, this could be medical services, this could be nutritional services, assistance of any sort. It's about 7.5 million people. Refugees in the country are about 189,000, and there are about 2.3 million South Sudanese seeking refuge in neighboring countries. So Uganda and Ethiopia and Kenya, and DRC are hotspots for South Sudanese to go and take refuge. In South Sudan, there are about 300,000 refugees from other countries that are taking refuge here. Now, what's the COVID crisis like in South Sudan? For starters, the first case, South Sudan actually was one of the last teams to have, one of the last countries to have actually started showing positive cases. The first case came up in April in April 2020. We started off with 1 case, slowly turned into 5, and between April and now May, we have about 500 plus, more than 500 cases, and the numbers have just quadrupled within this 2 months. And that became, so one of the good things that South Sudan did was, as soon as the neighboring countries started showing positive cases, we immediately ramped up preparedness in South Sudan. We started NGOs and UN agencies started talking about COVID prevention measures, started talking about how do you identify symptoms, how do you take preventive measures, how do you protect yourself, what do you do in a case where someone is COVID positive. So all of this planning started even before the country was impacted by the disease, which I think was one of the best things that has happened for South Sudan. Now, so as soon as the neighboring countries started showing positive cases, South Sudan went into a lockdown. Now, the good thing and the bad thing about lockdowns, we've also seen in India, is the same thing here as well. If the country goes into lockdown, that means daily wage laborers don't get food to eat. And that's very, very difficult in a country that is already severely living in poverty. And then you take away from them the little that they're making, then they don't have anything. And so here, the fear of dying of hunger is greater than the fear of dying of COVID. And so it becomes very difficult to talk about preventive measures, to talk about washing your hands, to talk about taking care of yourself and socially distancing yourself when they don't have an alternative. If you tell somebody, okay, don't go to work, stay at home, what's their alternative? What are they going to do? They don't have savings. They don't have food to eat. And so the crisis just goes overboard. Now, like I said, between April and now almost end of May, we've gotten about 580 something, 563 cases. And in these cases, some high-level officials are also in there. And so now the country has gone from, listen, we need to eat, and so we just have to do what we have to do, to sitting in fear, because if it impacted high-level officials who do have an ability to, socially distance themselves, to wash their hands, to sanitize their hands, if they are being impacted, then can you imagine the situation of people? And so that fear has started settling in. And unfortunately, that has also led to a lot of stigma among people. People don't, when you do contact tracing, which is a primary thing that needs to be done to slow down the process of spreading, people don't acknowledge or don't confirm that they have in fact been in touch with somebody who's COVID positive because of fear. Now, let's say I am a normal South Sudanese, and I met somebody who was COVID positive. If I say yes, I did meet somebody, I am required now to quarantine myself for 14 days, which is good sense. Everybody should do that. But that means my family will not get anything to eat for 14 days. So should I tell anybody? Or especially if I don't have any symptoms and I'm asymptomatic, should I just keep it to myself and do what I have to do, make sure I get some food for my family? Even if they can get one meal a day, I'm good. So that is the perspective that people have. People don't want to own up, don't want to come forward and talk about it, because they fear being stigmatized and ostracized, and above all, that they and their families will die of malnutrition, which unfortunately is a major reality here in South Sudan. The other difficult thing about South Sudan is that because people are not owning up, people are not talking, and now there is widespread community transmission going on, it's very difficult to contact trace. Like if you are working with an organization, in a day you go from one room to the other room to the other room to the other room. So if you ask me, who did you come in contact with? What am I going to say? My entire office? It's very difficult to do that. And because South Sudan relies so much on humanitarian aid, we organizations can't just shut down. That's not an option. We have to work, because, like, for example, if I don't work, if my organization doesn't work, then we are not able to provide life-giving services to people in South Sudan, which is a problem. So one of the things that is a difficult thing is that the numbers that are being produced and discussed, and the numbers that are being shown are actually inaccurate because of this, because contact tracing is so difficult, and because there's widespread community transmission. Also, the health system here and the lab here is severely lacking in capacity. And what do I mean? I'm not saying that they don't have trained people. I am saying that the number of cases and testing coming in and the capacity to do the testing and come out with results is very minimal. For example, the lab has about 2,000 or so tests pending, with the capacity to only do 200 tests a day. So that in and of itself is like, what do you do with that? But the good news is that the national lab has gotten a few more machines, and so hopefully the testing will become better. But another challenge is that there's not enough capacity building here, and that is definitely a need for South Sudan. Now, what are the challenges that you face here? The first thing, one of the first things that got impacted because of COVID is that there was a disruption in the vaccination schedule across the country. In 2019, measles broke out in South Sudan, which is obviously a major health hazard for children. And so organizations like UNICEF made way to be able to give vaccines for kids, and measles is given in three portions. And so they've done the first phase of giving vaccines, but the second phase now, unfortunately, because of COVID and because everyone's attention, also resources are being channeled towards COVID prevention and not so much prevention, but COVID, slowing down of COVID, these vaccines may not be able to be given to children. Now, it is a big deal in South Sudan if you choose not to shake somebody's hand. That is the primary greeting. You show respect by shaking someone's hand. So if I'm talking about social distancing and saying don't shake hands, basically what you're saying is you're telling people to disrespect one another. Even though that's not what you're saying, but culturally that's the understanding. And so if for humanitarian work to go on smoothly, it's very important that we maintain good relations with the local communities, with the chiefs of local communities, with PIAMs and the heads of those areas. And if you go there and you talk to them and you don't shake their hand, it becomes a very, if you're not gonna respect me, why should I let you in? You know, there's that tendency that goes on. And so NGOs, UN agencies, the Ministry of Health and the government of South Sudan has been working extensively and really, really hard to disseminate the information that one of the things that you have to do to prevent and to reduce COVID is to maintain social distance, to not wash hands, to not shake hands, to wash hands with soap and with water. And we're hoping that slowly that mindset would change and people would understand that not shaking hands is not a sign of disrespect, but I'm not shaking my hand because I care about your health as well. And so that's the perception that we're trying to bring out in all of our messaging around the country. The restriction of movement in the country again becomes an issue because the aid that is being provided in South Sudan are twofold. One is aid like providing food, providing medical services, providing nutritional supplies. That's all humanitarian aid. The second aspect is to provide sustainability. And the idea is to equip South Sudan and the people of South Sudan so that at one point they will be able to take care of themselves. So what does that look like? That is, we provide food security and livelihood practices. What does that mean? We work with farmers, we help them identify what food to grow in which season. So South Sudan basically has only two seasons. It has the dry season and has the wet season. When it is dry, it's really dry. And when it is wet, it is really, really wet. So there are special crop that you can grow in only specific seasons. So we work with farmers to identify in which season what plant you should plant. We work with them to talk about and equip them with efficient agronomical practices, what is going to help their food to grow better and quicker and in greater quantity. So the hope is that when you equip farmers like this, they'll be able to generate their own crop, they will have food to eat, and they will have enough to sell in the market and provide food for their communities as well. And that's an act of making the country more sustainable in the long run. Now, the same thing is done with fishing. Even though South Sudan is landlocked, it has rivers flowing through it, the Nile flows through it. And so fishing is also one of a major livelihood practice here. And so organizations, NGOs, we work with fishermen, teaching them about group fishing, how to fish well. And so we have all of these going on. And so now, as a mechanism to combat COVID, all the activities that are being done, whether it's straight up humanitarian aid or if it's sustainability activities, whatever these are, all these activities have a COVID aspect to it also. So let's say they're doing trainings for young mothers on providing nutritional food for their children. The first thing they will start with is to talk about, okay, how do you protect yourself? How do you protect your family? How do you protect your child from COVID-19? Then when you go to food distribution sites, which is, there are thousands of people coming in when there is food distribution going on. And so that is it's a challenge to socially distance there. But now NGOs have come together to spread out the food distribution activity. So what would have happened, let's say in 3 days, is now going to happen over a span of 1 week. And so that reduces the number of people coming to the food distribution site at a time. NGOs have started doubling up on the provision of water, started doubling up on the provision of hand washing stations. And so when people come for food distribution, the first thing they're expected to do is come, wash their hands, then you go stand in line. And there are specific markings that are put for people to stand. You have to stand within that square, and then food is being given to you. One of the other things that organizations are doing is, instead of providing, let's say, food for 15 days, ration for food 15 days, they now start providing ration for 1 month, for 2 months. That way, they don't have to come back, and they have enough food with them to take care of them for a substantial amount of time. Now, I had mentioned earlier that South Sudan's healthcare system is not very great, but to give you perspective, it's not just South Sudan. In most of Africa, in fact, there are 10 countries in Africa that don't have a single ventilator. That's the entire continent I'm talking about. In South Sudan, there are 4 ventilators, but there are also 11 million people. And so now it's become that if someone comes to be positive, if they're a positive case, they're required to isolate in their homes. No medical help is provided for them. Symptoms are treated. People who go to the hospital for treatment, they may be given paracetamol to take care of their fever and stuff like that, but they're then sent back home. This becomes a problem because as long as they don't have any more symptoms, that's okay. But what do you do when they start having shortness of breath? That becomes a problem because now healthcare systems are not really equipped to take care of it and to handle it. But NGOs are working really hard. The government is working very hard. The government has established a high-level task force to take care of, to establish ground rules for the country, to maintain regulations for humanitarian aid. For a long time, the airspace and all borders of South Sudan was shut down, except for bringing in humanitarian aid. But the challenge with these things is also that there's a lot of bureaucracy here. And so for an organization to bring in humanitarian aid, they still have to go through a lot of loops and holes and jump through chains and to get their clearances to bring in humanitarian aid. Another big issue with South Sudan and with Africa especially is the lack of water. The other day I actually saw a picture that was so gut-wrenching of a little boy. He was in a POC site and there was a hand washing station. Now, hand washing station is not drinking water, it's just water. And this child was standing there trying to drink that water because that's the only water that's available. And I know that for you and me to perceive that and to understand that, it's very, very difficult, but for this child, it's a reality. Soap is a problem. There's not enough soap to go around in the country. And so people end up washing their hands with mud, or they're washing their hands with ashes. How effective this is, we're not entirely sure. But if at all they do wash hands, that's what they use. And so that is an issue as well. It's not, the country is not equipped with ICU beds. In fact, the entire continent of Africa, there are 55 countries in Africa. Of these 55 countries, 43 countries have ICU beds. But in 43 countries, there are on all 43 countries put together, there are only 5,000 ICU beds. That means that's only 5 beds per million people. That is an insane number, but that is the reality here. So the game plan for a country like South Sudan is to slow down the process of transmission, to not stress the healthcare system so that someone who desperately needs healthcare will actually get it. If you stress out the healthcare system, then there's not a lot that anyone can do. One of the things that organizations are doing is bringing in experts who have had experience in infection prevention and infection prevention and control. People who've worked in like an outbreak like Ebola. They're coming into the country now to support the healthcare system, to work with frontline workers, to train them on how to handle the disease, how to control the spread, how to protect themselves and still provide healthcare. Now, what else are humanitarian organizations doing? What are humanitarian actors doing? One of the primary things that we're doing, education, education, and education. It is so important to educate the community here because the symptoms for COVID-19 are so similar to symptoms of malaria that people just assume that it is malaria and treat themselves for it. Now, if the treatment works, great, but you don't know whether after your symptoms are gone, are you still a carrier? What's going on? We don't know that. So that becomes a challenge, but education is going to help them break that stigma and know, okay, unless I isolate myself, my family is at risk. And so while education is important, we also have to be able to pass on this education to community members without us being people who are further spreading the virus. So one of the things that we do is trainings are done in smaller numbers. So if you want to provide education to young mothers in the country, then a smaller group of mothers who are called lead mothers, they are trained. Usually trainings are done in groups of 10 and 15, no more than that. That way people can socially distance themselves and they're kept safe. So lead mothers, we have lead farmers, then just community leaders, church leaders, they all receive training on what is COVID-19, what are the signs and symptoms of COVID-19, what can you do to prevent yourself from getting the infection, and if you are infected, what do you do? So these are the 4 things that are covered during these training sessions. And these, the leaders who are now trained further take the trainings to their homes, to their communities, to their friends and family. And that's called a cascading method. And so using the cascading method, information and just awareness about the disease in itself is being spread throughout the country. When possible, NGOs are working to gauge the capacity of health systems, to see what they lack and how they can be, what capacity building can be done. And right now, the primary game plan, as I mentioned, is to just slow down the transmission of the disease, slow it down enough so that those who require help can actually get that help. So that's basically like as broad and as limited that I can get in my discussion. But what I'm sharing with you is just based on my experience here, working in a humanitarian scenario, working in humanitarian aid, and just what I've seen, what I've noticed, what I've learned here, not necessarily my organization's perspectives, but definitely mine as a humanitarian aid worker here in South Sudan. Thank you.
Rachel, it's such a joy to have you here, see you speaking, and so comprehensively and so well. We are so appreciative of all of
Thank
your
you.
perspectives this evening. And we'll wait and I'm also glad to tell you that some of your classmates, Tripti, Venus, are here, the other side,
Oh,
watching.
hey guys.
And Ebenezer sir is there.
Hi, sir.
And your mom is there.
Of course, she's there.
So good to have all of them. And so let's see if they have some questions, and then probably we'll take it forward.
Sure.
Sir, we have a question from Amrit sir.
Yeah.
Hello, ma'am. So Amrit sir is asking that what role does the mainstream or alternative media play over there in enhancing the capacity building or institutionally sustainable measures?
So can you see the last part?
The capacity building or institutionally sustainable measures, enhancing the capacity building.
See, right now, I think one of the biggest challenges with the media is that any information is being spread, which is a problem. What is important, and I'm speaking specifically with COVID perspective in mind, unfortunately, a rumor spreads like that. And when it goes through the media, there's a certain level of authentication that comes to that message. Unfortunately, the messages that are being transmitted are not always accurate, which play into stigmatizing someone with COVID as well. So I'll give you an example. When the first 5 or 6 cases of COVID came up in South Sudan, the media not only broadcasted that there were 5 cases, as it rightly should. People are supposed to know, yes. But it went on to identify that they were foreigners and they are working with this particular organization. And the next thing you know, all over social media, there are people who are saying, we need to kill the foreigner. And it's straight up just that, get the foreigner out of the country. But that's not the issue. The foreigner is the one bringing you the foreign aid. So if you're just going to say, get lost, you need to leave, you can't do that. And so the need for media right now is to be a little sensitive, to have a filter in what they're saying. I'm not saying you should, I'm saying be accurate with your information. Don't just say or give information that you know will be harmful. Why would you do that? And especially because we don't want to frighten people. Now, COVID-19, the disease in and of itself is not, it's not super deadly. The fear or the problem with COVID-19 is that it's intensely infectious. That is the problem. It's not that out of all of the cases that are found in South Sudan, just anywhere, maybe 20% of people will demonstrate symptoms. Everybody else is going to be asymptomatic. But when you talk about a foreigner bringing it in, now you've taken away focus from the disease and what we're saying about protecting yourself to it is a foreigner who's brought it. So we're going to channel all our anger towards them. So the biggest role that media can play isn't just giving, it is in being sensitive with information and also providing accurate information.
I'm also, sir, is asking that are there enough development or health communicators who engage in crisis reporting? Do they work closely with humanitarian organizations?
They work closely with UN agencies because all of the humanitarian work that does happen here, it happens through local NGOs, through international NGOs, but the UN agencies are the primary funders and the ones who are channeling out the work. And so media especially works closely with the UN agencies. And the UN agencies are really very good with doing press releases, at doing media, well, not now, but doing media gatherings and giving out messages to the media. But usually information information that the media and the press have comes straight up from UN agencies, or information on something like COVID-19 comes straight from the Ministry of Health and not necessarily from the NGOs.
Okay, ma'am. And I have a question, ma'am. You said
Okay.
that there are around 563 cases which are reported as of now. 563.
Yes.
Are there any cases reported in POC? I mean, the
Unfortunately,
refugee
yes.
camp. Or...
I don't know how many cases are there in POCs, but the COVID-19 has definitely entered into POCs, and so now we're just it's a matter of embracing for impact. We know that the disease is already here. We know that there is community transmission, and so it was just a matter of time before an infection went into a POC camp.
Any more questions? All of them out there have words of appreciation for you, Rachel, and for your talk, and they don't have any questions, it appears. Katie sir is asking, have you learned the local language to be effective?
I can say Kefal Hal, Tamam, Shukran, Jazeeran, that's all. Nothing else. But thankfully, our local staff know the language, and so I don't have to worry about learning Arabic and Dinka and Noer.
Is it close to Swahili?
No, sir, not at all. Actually, South Sudan has so many different languages.
Okay.
Arabic is one of the primary languages, but it's not classic Arabic. It's so, like for example, Juba, which is the capital city, has Juba Arabic, and then you have like Arabic that's spoken in Sudan. But primary languages are Dinka and Nuer, which are also the primary tribes in this country.
So these are tribal dialects, are they?
Yes, they are.
Are there more questions, Murli?
Yeah,
As of now, no. I'm just seeing for that.
yeah,
Yes, sir.
everybody has words of appreciation and no question. That's what I said. I'm just looking at the YouTube chat box.
Thank you.
It was really comprehensive and informative to know
Thank
what
you.
is happening over there
Absolutely.
and what kind of
True,
work
true,
is-
ma'am. Very much.
Absolutely.
Thank you. Thank you.
We are so proud of you, Rachel, and all your accomplishments. And today's talk just proved us right once again.
Thank you, sir. Thank you. That means a lot, especially coming from you. Thank you.
Such a joy to see you. And for all those who join later, Rachel is from our first batch, and we are so proud of her as a department, as a college. And even while she was in Hyderabad, she was doing some freelance help for the college, the development of the website and so on. So her association with us have been long-standing. And I also want to once again say that she, along with Trupti, who is there in the audience, had composed the college song, which we have adopted it as college song, and it's been sung till this day. I don't know whether you want to sing it now or.
I'm okay. Probably not.
Okay, if there are no questions, 1 minute. And yeah, there is one from Michael sir. Do people of Sudan understand how rapidly the disease is spreading, or do they think it's just another disease?
South Sudan, I can speak for. Unfortunately, there is so much of disease here already that it's very difficult to explain to people why new measures are being taken. Now, for example, malaria is a very, very common disease, and people die of malaria here. It is a big deal. But they've seen it for so long that it's like, oh, if it's malaria, we can't do anything about it. So they sort of get desensitized to it. Now, when you bring in infectious diseases like Ebola, and then you bring in infectious diseases like COVID, it's very difficult to explain to people how for years you've been eating bushmeat and now it has an impact in this Ebola outbreak. So getting people to get that perspective of, no, this is a reality is very, very difficult. With COVID-19 also, it's the same thing. When it was 5 cases, 6 cases, and it was only, a foreigner, it became all about it. It's a foreigner disease. So if you are a foreigner, you will have it. And for a long time, the messaging that went out was, if you have international travel experience, then you are more susceptible to COVID-19. When the reality is, you can't say. It may have, initially, yes, if you had international travel experience, that was a concern. But now you can't still be talking about it because now there is a widespread community transmission. So now it becomes ineffective to talk about that. So initially, that was the response. The response was, it's just another disease, or even more, it's more of, I couldn't care less about it. And there are so many myths about it where people, for the longest time, people would say, listen, COVID-19 is not going to come to South Sudan because it's very hot here. But the temperature has nothing to do with the virus. But people strongly believe that that's what it is. Because of how hot it is, nothing's going to happen. And then there was information that if you stand out in the sun and soak yourself in the sun for a certain amount of time every day, you'll be COVID-free. And right now there is this, it's, how we have these baggage tags, they look somewhat like this. And you stick it on your baggage and you write your name on that. There is something like that going around right now that says if you have that on your person, if you wear it like a badge, you will not get COVID. It's very, very sad how many myths there are, which is why there is a need for authentic information that comes straight from WHO, from CDC, from Ministry of Health. But all that to say, yes, sir, when it started off, it did seem like it's just one of the many diseases that I hear. But I think now, with how quickly the cases are rising, people are slowly understanding, okay, maybe this is something we should be careful about.
Yeah, there is also a question from Mr. Zephaniah Peter. You know him.
Hi, Uncle.
Yeah. He is asking, will more POCs be helpful in reducing social distancing?
That question, I honestly don't know the answer to. I don't know if there is capacity to build another POC. What they are doing right now is encouraging people to go to the villages, to go back home. Since a lot of people moved out of their homes because of communal violence, because of war, but now that war has settled down, it is better and safer for people to go back home. And so the encouragement is to go back to your villages, because Juba is the epicenter for the disease. It's not in villages. And it will take a very long time for this condition to go from Juba to the remote parts of the country in any case. And so the government also is encouraging, not refugees, but encouraging IDPs to go back to their homes, especially if they have vulnerable people in their families, if they have elderly people in their families, to take them and to go to the villages so that they're safer there.
Okay.
Ma'am, we have a question from Arpita Ma.
Okay.
Yes. Arpita Ma was asking, why did you decide to work in Sudan? What inspired you to take up such a difficult responsibility?
That's a very good question, but it's a bit of a story, and I'll try to write it as much as possible. So I went to the US to study there. I came back to India in 2016. When I came back, I was still working with this organization that I'm currently working for, and I knew that they worked a lot in humanitarian aid. And my desire for as long as I can remember has been to work in humanitarian aid. I feel like we're always talking about what is someone else doing to address a problem, that we forget that you actually have a role to play. It's a different issue that you don't have to be part of a humanitarian aid organization to do the right thing, but working with an organization like this really helps you get into the heart of things, to the dirt of things. When I was going to come here, a lot of people asked me, what is wrong with you? The whole world is running away from disaster and you want to run into disaster. You've clearly lost your mind. But, you know, at the end of the day, firstly, I got a job here, which is fantastic. And that too, how many people can say that they love their job and it is exactly where they want to be? So for me, it was, I was going to get to do communications, which is my passion. And I was going to get to do communications in a humanitarian sector, which was something that I really wanted. So that's why I came to South Sudan. A lot of people asked me this question and said, well, there's enough of disaster in India itself. Why do you have to go to South Sudan and do it? So my answer to that is, I have to start somewhere. And people are people, whether they're in India or in South Sudan, and they all need help. I have my friends who are working tirelessly in India. So I'm now working tirelessly in South Sudan.
Rachel, there is a question from Elcita Sandra. On a very light note, she says, how can a faculty encourage students to participate in virtual classes during pandemic? All of us as teachers are during this time. So I would like to hear from you as well, because we did have challenge having them on online classes.
I'll tell you, sir, why it's a challenge. It's a challenge because all of these students have a whole house to walk around in. If you have a single room like I do, you will take any chance to interact with anybody. So if you are being frustrated and you don't want to attend classes, my encouragement to you is lock yourself in your room just 2 days. That will change your perspective and you'll want to interact with everybody, with your lecturer, with your professor, with your classmates, with everybody. But on a slightly serious note, I think it's such a blessing that we still get to, not me anymore, unfortunately, I'm not a student. But I think it's such an immense and a blessing that you are still able to attend classes, even though you're not going to school, going to college. Professors, lecturers, teachers are taking time out of their own lives and trying to learn new technology so that they can cater to our educational needs. And I think that's something you should never take lightly. And once you get out of college, you learn how important your educative years were, because that's not only going to shape you, it's also going to help you understand what your calling is, where your niche should be, where you want your passions to go. Otherwise, I'm telling you, we often think that once I'm done with college, I'll get a job. Okay, what job are you going to get? Where are you going to get? In which industry are you going to get it? Are you going to look at a lateral move? Or are you going to look at an industrial move? These are all questions you're going to come up with that have answers right now in your classes. So go to school, go to college, attend your online classes. And plus, Mary's is a fun class. I don't know why you'd not want to attend it in the first place. Like, I went to college very regularly.
True.
Ma'am, there's Katie sir has another question. How do the people behave with the volunteers who are serving the people during these testing times?
There are two ways that they interact with us. One, obviously, when you're giving help, people are very grateful for it. But on the flip side, when you go into a community and you talk to them about staying at home without taking food for them, it's very frustrating. And there have been instances when communities have spat at people, have beat people up because they're like, you don't know what you're talking. You are sitting within your compound, you have all the luxuries you need. More than anything, you have food, shade, clothing, you have water. We don't have anything. You're talking about washing hands. Where's the water to wash hands? And so they're not entirely wrong, but it's a very frustrating situation. So it depends. Sometimes people are obviously very grateful because they understand that without humanitarian aid, there's nothing that you can do. But at the same time, what we're asking of people right now is it is a tall order, telling them to stay away from markets, to not go out, to stay within their homes without providing food. That's a difficult thing.
Sunny Raj asking that how is media dealing with the fake news there?
So one of the ways that NGOs here work, they work with clusters. So a lot of NGOs, not just NGOs, but a lot of sectors of NGOs come together and they become a cluster. So for example, I'm part of the risk communications cluster. And so other communications managers from different organizations come together to form this cluster. And we do what is known as a rumor tracking. So as and when you hear stuff within the community, it's tracked, and then UN agencies will do messaging that that counters the myth that is going around. Does that make sense? So rumors are challenged and challenged with accurate information, but that's done because of the clusters that we work with.
Ma'am, again, Triveni is asking that what is the role of faith in the wake of this pandemic in Sudan?
South Sudan has two major faiths. One is Islam and the other is Christianity. And so church leadership especially is held with high regard. And so organizations, NGOs, and the government will work closely with churches, with church leaders, with bishops, with heads of organizations to talk about this issue, because now when the bishop is also talking about it, it brings a certain extra level of authenticity to the information that is being shared. And so we work a lot with churches to share information with their congregation, who will then share information with their families, with their neighbors, and with their community. So that's how South Sudan is not a place where you have to challenge and say, is there a God? Is there not a God? That's not even an argument here. Everyone is of the belief there is God. And so faith actors play a big role in being able to pass on information and cascade information out to the community. And because they're the ones cascading it, they bring a level of authenticity to it.
Okay, there is one more question from one Vijay Blade. It says, before the lockdown, what was the source of entertainment in South Sudan?
Entertainment?
Yeah.
What is this entertainment you speak of, my friend? No, I mean, people have, actually, I don't know if people have televisions. I don't think they do. But radio is a big deal, especially in POCs. UNMISS, which is the United Nations Mission in South Sudan, they have radio stations. They have Radio Miraya goes around in all of the POCs, which is also used as one of the primary measures or ways of disseminating information into the communities. So radio is a big thing because it's free. There are a lot of drama groups that do, like whenever it comes to providing information again to communities and to POCs, drama groups are trained to do this. That way it's entertainment, but they're also getting the message across. For me, personally, entertainment would be like, I live on a compound with other humanitarian aid workers. We have workers from Kenya, Uganda, Ethiopia, US, Australia, Canada, India, and Nepal. So we play games, we play Uno, we play Catan, we play soccer, we have a basketball court, people play basketball. And if all else fails, there's Netflix, if you're lucky.
Okay, thank you so much, Rachel. Over to Priyanka for her closing of the meeting.
Thank you, ma'am, for the amazing insights. It was indeed a very valuable session, and we got to learn many new things. We were not aware of what was happening outside the world as we were busy here. So, yeah, it was really amazing. And I would like to propose vote of thanks. Thank you to our head of department, Dr. Joseph Christodous, and our faculty members for giving us such an amazing opportunity and letting us know more things about what is happening around us. Thank you, ma'am, for giving us much information than we thought it is. So thank you for everything, and thank you, participants, for making this event a very grand success.
Thank you.
Thank you.